What is a woman?
That's a good question.
Biologically?
We'll start
tell
with
me.
you. Go ahead.
Uterus.
What is a woman?
Uterus, cool.
Uterus,
has a uterus.
hormones.
Are there
etc.
other definitions of women that we should accept?
This is an important. This is
actually
definitely
not a
dating
silly
related,
question. This is
dating
super
related.
important. It ties with the other one.
It ties in with feminism too.
Yeah.
Sure. That's the ground. That's the fundamental
Question.
importance.
Fundamental.
Yeah.
Important.
How about this way? Anybody can chime in. Can someone that doesn't have a uterus that has
Wait, should we just go around and let
Yeah,
them-
sure. Go.
What is a woman?
A woman is someone with a uterus. However, a uterus doesn't always define a woman because, for example, you can have your uterus surgically removed. You're not any less of a woman because of that.
Should we have them all answer?
Yeah, I think so. Yeah.
And then if you want to respond, go ahead.
Yeah, I believe that a woman has a uterus, so.
So that would make me not a woman, in essence.
Here, let's let the girls answer. Go ahead.
No.
You're asking if gender and sex are synonyms, and that's the big debate. If you think the word woman is a synonym for the word female, then you would say a woman has primary and secondary sexual characteristics. If you're saying the words woman and female are not synonyms, then you could include like trans people who call themselves women but don't have the first or primary or secondary characteristics. So that's the debate, right?
Anyone with a uterus.
Or had
I mean, biologically, it's someone that has XX chromosomes.
Yes, someone with a uterus.
XX chromosomes.
I mean, yeah, I think there's men and women. There's not really anything in between. I think you need to be born with uterus, vagina, boobs,
Yes.
everything.
Well, intersex
So-
is more common than red hair or green eyes.
It's not true, but that's okay. It's a
Is
good
it about
talking
1%,
point. It's
right?
not true. No,
It's not?
even close. But it's a good talking point.
What is it then? Because it's not
like
zero.
It's like 0.001%. But
They
it is
exist.
more. It totally exists. Yes. No, I only pick on you for that
No.
because.
If I'm wrong about but they do exist. So we do have people that
100%,
are
yes.
that are not male, sort of, not female, sort of.
But it's a deformity, right?
Right,
So,
but they're not choosing to be trying to become a
Of
female.
course,
Yeah.
no,
Trying
I'm
to
not talking
become a
about
male.
something
so
else.
for example, if I was born without a leg, that's absent of being two-legged. It doesn't create a new category of something, right? So,
Okay.
and it only intersex is XXY. So they're either more female or more male. They're usually more female, but sometimes they cannot have both sex organs, aka they cannot impregnate themselves. So it's
Hermaphrodite.
Yeah,
Right, yeah,
exactly. Let me ask it this way: does anyone believe that biological men can become a woman?
I think people can call themselves unicorns at this point in time if they want to. So if that's what they choose to say, that's what it is. But becoming a woman is a very, in short, no.
I'm not going to deny trans people as women.
Okay, so can I pause there? So if, as a woman, can womanhood then just be appropriated? Someone can then say, I am what you are.
No.
You said you're not going to deny trans women.
Yeah.
So Dylan Mulvaney, who's a biological man who thinks he's a preteen woman, is he a woman?
I feel like I'm just not in the position to tell him he's not a woman. If he says, if they say that they are a woman, I have no, you know what I mean? I'm not going to be like, are you a woman? Are you a man? That's nothing to do with me, honestly.
Got it. So if I'm 30, if I said I was 12, would you acknowledge that?
Yes, I would.
You would? Okay.
Yeah.
I would acknowledge it as dumb.
It's dumb. So why is it dumb for age? But I guess your answer previously.
Yeah. Mhm.
But why is it with sex or gender, we kind of get really cautious and saying, well, I'm not going to deny it. But if I said I was a wolf, you would laugh at me. If I said I was a giraffe, you'd laugh at me. But with sex and gender, we're like, oh, you could be whatever you want.
Because it's, I don't know, honestly, I've been looking at it from different perspectives ever since that issue kind of came up. Because I'm also, like I said, religious and also believe in the Bible. So it's like really conflicting, you know? But I feel like I heard this one thing on it where it was saying that it's almost like, again, I'm not saying this is my concrete belief, but I just heard this, which kind of made me think a little bit more about it. And they were saying how it's kind of like a mental illness. Like, you know how someone could be 30 and they could truly believe they're 12. Like, those people really exist. It's a mental illness.
Yes.
Those people exist. You don't deny them that they exist. You don't tell them, yeah, you're 30. Like, what are you doing with your life? Like, you acknowledge that it's a mental illness. and you treat the person as such.
Great point. So if somebody, you're in healthcare, came to you with, and they said, I'm anorexic, so I think I'm fat. And they said, I want liposuction, which means the forcible removal of fat. Should you give them that surgery?
Of course not, because that would be compromising their actual health.
Hold on. But you just said that we have to affirm somebody's mental illness. They want liposuction. Why shouldn't they get it?
No, I didn't mean affirm their mental illness as in accept, oh, you are 12. I'm saying we shouldn't treat them as in, you shouldn't go up to them, to the 12, the 30.
The 30-year-old who thinks he's 12, which is a thing.
And you shouldn't, because like that's how people talk to trans people, right? They'll go up to them and be like, ha ha, you think you're a woman. Treat them with that disrespect and all that disdain. Whereas if you see the 30-year-old who's a 12-year-old, you don't go up to them telling them that they're 30. You accept that they have a mental illness.
Of course.
And you
So
know what I mean?
let's apply it to the trans thing, the 30-year-old, 12-year-old, and the liposuction thing. Wouldn't it make more sense to treat the person and say, you're not what you think you are, rather than affirming the lie that they think there's something else? Because in the liposuction example, anorexia, you'd be like, no way would we give you forcible removal of fat if you're anorexic.
But they'll just go to the next doctor who will.
Will they? A doctor will not, under current medical procedure, give liposuction to anorexia
In America.
patient. Correct. But in trans care, a 14-year-old can get their breast removed if they think they're another sex, if they think it.
See, and that's where like it's really complicated, because it's like if it is a mental illness, and if that, I'm not saying I 100% can't believe this, but if that's the case, then there should be a line of marker, because it's like you shouldn't let someone who wants to mutilate their genitalia before their brains even develop.
I totally agree.
Do that if it is a mental illness and it is something that's heavily messing up their brain. 'Cause what if
you're onto something?
you know-
So the question is, when it comes to trans people, why don't we treat their brain instead of their body?
See, I feel like, yeah, that's a really good point. That's a really good point. I can't really argue against it. I also, even though I accept trans people and I do believe that trans women exist, I'm not going to deny them of.
I don't know. You're
know?
you're closer.
But
You're
if
just
my
saying that as
daughter-
I think you're saying that as a talking
But
point.
listen,
though.
but if my daughter, who is 10 years old, tells me, Mom, like I want, or actually let's make this easier. If it's my son that tells me, because that way he has a genitalia that could be cut off, right? If he tells me, Mom, I'm not a boy, I'm actually a woman, mutilate my genitalia, I wouldn't do that.
Okay.
I
but,
wouldn't.
But you just said.
But if they turned 18 and they asked me, Mom, will you consent to me doing this? Like, will you disown me as a child, or are you going to accept me as your child who's a woman? I would accept them as my child.
You're being consistent, and at least you acknowledge the adult-child distinction, which is super important. Which right now, just so we're clear, in California, as a 14-year-old, you can get your breast chopped off, hysterectomies, like insane, irreversible damage.
I don't believe that should be the case.
It's great, and I think that's a
Yeah.
bipartisan agreement. However, it gets back to the question of, and I don't even know if you believe it, but you're saying it, that you say trans people exist. Okay, they exist as human beings. The question is, are they objectively the thing they say they are?
I'm not one to answer that.
Fair enough. Does anybody have a comment on that?
They used to call it gender dysphoria, right?
Yeah, that's what it was in the DSM-3, DSM-4, and then the DSM-5, which is the Diagnostic Statistical Manual for Psychiatric Care in the United States. But no, you've been intellectually honest on that. And I think it's not a silly question, because I'm here with a panel of women. What it means to be a woman is a very serious thing, and it's a beautiful thing, but it shouldn't be trivialized for somebody that can just appropriate it, wear a dress and some makeup, and all of a sudden they enter the club of womanhood.
It's sometimes frustrating what the most ardent ones think is womanhood, that it's just wearing pink and prancing around. Women are
But isn't
more
that an
than
insult to women?
It sometimes feels that way to me. Is like,
Do you
that's
think
what
it's
you
an
think a
insult?
woman is? Like, we fly planes and shoot guns. We do other stuff too.
Yes. But you're
and
complex,
of course the big one, motherhood.
beings made in the image of God.
Yeah, it's like some weird
Not
neat-
just a costume. It's not like dressing for Cinco de Mayo or something,
It
right?
feels like they're wrapping themselves up in cosplaying womanhood in a sometimes weird way.
Yeah, you brought up Dylan Mulvaney, and in his first videos, like the day one of womanhood, was like, well, I cried 4 times and like went into credit card debt, and it's like, is that what you think this is?
Thanks a
Yes,
lot,
but they
right?
do, because they think that again, I don't. Sorry if I'm interrupting, Brian, but I don't trivialize that some people that are trans are suffering. So the question is, how do you treat suffering people with the truth? So in a medical situation, if somebody comes in and you take their diagnosis, what they want, and you know that there's something better for them, then you should lose your license as a doctor. It doesn't matter what the patient wants. The doctor should be treating them towards, but the issue is that the new standard of care is no longer to try to bring somebody back into biological alignment of their birth. It's now to try to let them on whatever journey they might think they're on. And especially with youth, that's a dangerous trajectory.